Title: Cancer's Invisible Enemy, More Than Chemo Shortage, It's a War on Life. TLDR. Waking up to a drug shortage. More than 90% of big US cancer centers are facing the nightmare of not having enough chemo drugs, reveals a fresh off-the-press survey. Carboplatin and cisplatin, two life-saving combos that kick cancer's butt, are MIA from the scene, leaving docs in a fix and patients in fear. The big Q is, can we afford a drug shortage during such critical times? Full story. Hey, turned up news gang. Ever dreamt you're about to rock out on stage, but the electric guitar's missing? Well, that's how oncologists across the country feel right now, missing their life-saving, cancer-kicking, power-cord drugs, carboplatin and cisplatin. Not funny, right? It's not a hidden camera prank either, folks. In a recent survey, 93% of 27 cancer centers reported a scarcity of carboplatin, while 70% were deprived of cisplatin. These two drugs are like Batman and Robin in the fight against many types of cancers. The scarcity has left medical teams scrambling like crazy to find substitutes. CEO of the National Comprehensive Cancer Network, Dr. Robert Carlson, stated, "This is an unacceptable situation." Do you agree with him? Are you as worried as we are? To put things into perspective, these platinum-based drugs are prescribed to an estimated 10 to 20% of all cancer patients. So, imagine the scale of the crisis. Yet, most centers are still pulling all-nighters to treat patients, according to the intended dose and schedule. But when can we expect a regular supply to hit the shelves again? Your guess is as good as ours. Strangely enough, only about 40% of centers have been tipped off by manufacturers or suppliers about when the dynamic duo, carboplatin or cisplatin, will be back in action. So, what's up with the rest? As the US wrestles with drug shortages, cancer treatments are among the most affected. As of March end, around 24 chemo drugs were actively missing from the scene, making it the highest shortage since 2014. Here's a ray of hope, though. The US Food and Drug Administration, FDA, is now teaming up with Qilu Pharmaceutical, a Chinese drug maker, to import cisplatin. Apotex, a Canadian pharmaceutical company, will also join the battle by distributing the injectable medication temporarily. Will this be enough to cover the shortage? Will this international teamwork be the game changer? As the crisis unfolds, Alyssa Schatz, the Senior Director of Policy and Advocacy for the National Comprehensive Cancer Network, urges for a united action. She said, "We hope we can come together to prevent future drug shortages and ensure quality, effective, equitable, and accessible cancer care for all." And we at Turned Up News can't agree more. But what about you? Will this call for unity echo loud enough to prevent a health crisis like this in the future? This article does not provide medical advice. It is intended for informational purposes only. It is not a substitute for professional medical advice, diagnosis or treatment. So, are you ready to dive into this conversation, Turned Up fam?